Post-traumatic stress disorder, or in short, PTSD, arises after highly stressful psychological events. By definition, these involve a person witnessing an event that poses a risk to life or injury to themselves or other people. A single event is enough to trigger this disorder, but the risk rises with repeated exposure and if actual injury or death is involved. It is estimated that 50% of the people in Western countries will experience an event sufficient to trigger PTSD in their lifetime, and of these, 10 to 20% develop the condition. The overall prevalence is 7 to 9%. The condition can be incapacitating and often delays or prevents a return to work. Some groups witness such events in their working lives, and as a result, they are more prone to PTSD. These include anyone on frontline service where such events are encountered, such as ambulance crew, police officers, firefighters, accident and emergency staff, and operating theatre staff. Unlike other disorders, PTSD is not abnormal in nature, but in duration. People's response to severe stressors include reminders of the events, flashbacks, intrusive thoughts, and nightmares. Excitation, insomnia, agitation, irritability, anger. Inactivation, avoidance, withdrawal, confusion. These reactions to psychological trauma resolve within 1 month for the normal population. In people with PTSD, they persist beyond 1 month for acute PTSD and beyond 3 months for chronic PTSD. Or they can reappear after an interval of normal recovery in delayed onset PTSD. Previously, debriefing was advised as a preventative measure after severe psychological trauma. However, this was found to increase, not reduce, the rate of PTSD. Normal recovery occurs in most people and involves a progressive decline in the memory of and attention given to the stressful event. This is impeded by revisiting the event in debriefing. The relevance to healthcare professionals who are at risk of this condition is in secondary prevention strategies used after a traumatic event to minimise the risk of PTSD. Both treatment and secondary prevention are aimed at social support and avoidance of memory triggers. There are 3 so-called Ps to avoid. Pathologize. Symptoms within a month of events are a normal response. Psychologize. Work through the issues by debriefing or group therapy. Pharmacologize. Treat with anxiolytic drugs.